let us help you get some of the supplies that you need, whether that's a hospital bed, or maybe that's an electric wheelchair, or a walker or a cane, or maybe your handicap placard. I fill out forms to give people handicap placards for their cars all the time. It may be physical therapy, occupational therapy. It can be also a social worker, which I'm oftentimes helping my patients get to help with things, and supplies in general, to be honest with you. A lot of folks, a lot of my patients, I come to learn, don't actually know many of the supplies and opportunities and devices and things they have access to either through insurance or whatever that sometimes your doctor can help you with. So make sure that you're involving us in the process of you being a caregiver and in the person you're caring for, their lives too, because hopefully we'll be able to help with some of the supplies you need. Guys, we're talking about tips to help you as a caregiver, and God bless all of you who are taking care of loved ones. It is literally, it's a gift of love that you're giving to your loved one. It also can be a labor of love as well. So I want to make sure that we're talking about things that not only will help you give care, but also help you make sure that you're taking care of yourself, because that's so important. By the way, guys, I'm Dr. Jen Caudle, practicing family physician, on-air health expert, and video creator. Okay, so that's the first thing. And in addition to that, by the way, guys, I have a number, and you guys know I'm a family doctor. I have a number of patients who say are caregivers to their parent, their mother, whatever. And what they end up doing for ease is they combine, or rather they make sure that the person they're caring for and themselves, that they go to the same doctor, go to the same health facilities, the same specialists, because number one, it makes it easier. Number two, it can also help facilitate office visits. As a caregiver, we know it's often hard to care for yourself, to get to your mammogram appointments, to your urologist appointments, to your colonoscopy appointments, to your general doctor appointments. Well, what a lot of my patients do is they have me as the doctor for themselves and the loved one that they're giving care to, so that they can make back-to-back appointments, so that they're both in the room at the same time, of course, if that's what you wish. And we do one after the other to make sure that everybody gets the care they need, the caregiver and the one being cared for. Consider that as well. The other thing that we doctors and other services can help with this too, by the way, is also helping with transportation services. There are a lot of things we can help with. I know the social workers and the nurse navigators in my office are, I don't know what I would do without them, and they help so much. So make sure that you're getting access to those things. Also, remember, in this day and age, telemedicine is often used now more than it ever has been. This has been a great resource for many of my caregivers and the people that they are taking care of, because sometimes getting out of the house is tough. And if your loved one who you're caring for needs to have a doctor's appointment, but they may not actually need to physically go into the doctor's office, it could save you a trip. It could make it easier on your loved one, especially if they're ill or not feeling well, etc., has just undergone surgery. So keep that in mind, those options as well, okay? The other thing, and by the way, I've got sort of 5 general categories of tips. That's the first category, which is a big category, but I wanted to sort of give you those thoughts. Second thing is support groups and support in general. There are lots of amazing support groups out there. Support groups on Facebook, support groups that are in person, support groups that are happening over Zoom. This also is something you can ask your doctor about, but also I'm going to give you a few resources online that you can check out that can provide these. But it's not just support groups, right? Because some of you might feel like that's an extra job, that you now have to seek out a group to be supported, especially if that's not your thing. I also advocate and ask my patients who are caregivers, I encourage them to ask for support. It's interesting. I've had some of my patients say, I'm so surprised my sister or brother never offered to help me, and I'm the one taking care of our mom. Or my family members never come over and give me a break, or no one ever helps. And to be honest with you, that's a whole nother video and a topic for another day. That is something that so many families go through. By the way, if it's you, you're not alone in that. But what I will say is that sometimes asking for support is a really good way to go. Simply asking people to help, whether it's your family or your blood family, or your chosen family, non-blood family, your friends, just saying, hey, you know what, I gotta go run some errands, pick up prescriptions, go to the pharmacy, would you mind coming over and watching my mom for just a couple of hours? Or, we're really having trouble with this. Could I ask, would you mind taking her to the blah, 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 blah? Sometimes it's hard for us to ask, but you know what? Ask. There are a lot of people that are going to be happy to help. Okay. The next thing, so it's not just support groups, but support in general. Number 3, let's see here. Where's number 3? We always say, caregivers, you need to have time for yourself. You need to take care of yourself. Well, you know, it's true and that's right. But the question is, how do you do that? How do you do that while being a caregiver? One thing, this is something that has happened in my own family when my parents have taken care of loved ones, etc., is that the person that they're caring for may go to like an adult daycare center, maybe 1 day a week or 3 days a week or something like that. And I have many patients who either have children with special needs or family members with special needs or not with special needs who go to an adult daycare center for a couple days a week. It helps the person who's receiving care, gives them socialization. It's another environment, but also gives some space for the person who's giving care to get stuff done, to take a nap, to do self-care, to maybe go to the movies. Because by the way, just because you're a caregiver does not mean that that's all you are or all that you're supposed to be. It's still ideal that you live as much of a full life as you possibly can. Now, we're talking about this topic because Lord knows it's difficult to do when we're taking care of others. But it's why I'm talking about this, because I want to encourage you to keep in mind that you deserve a full life and to take those moments to take a moment out for yourself. Okay. And if you're one that tends to feel guilty or feel bad for doing that, oh, don't worry. Hold on till topic number 5. All right, number 4, let me give you some organizations. And I've also written an article on organizations that are really great at providing caregiver support resources, whether it's training on how to become a caregiver, how to become a better caregiver, resources from legal resources, how to find a lawyer to help with estate planning, how to have tough conversations, how to find help, etc. Let me just give you a couple of these organizations. Also, I'll try to put the link to this article in the description of this video and in the comments. But if you don't see it, please make sure that you just send me a message just to say, or just write a comment and say, hey, can you send me the link to the article? But there's a few. You want to check out your local area agency on excuse me, that's such a tongue twister. Your local area agency on aging, AAA. Also, AARP.org has some great resources. AARP.org/caregiver, caregivers or caregivers, something like that, has a lot, like a plethora of stuff. And interestingly enough, also organizations like the Red Cross, they have trainings for caregivers, and also an organization called the National Family Caregivers Association. They have classes too, as well as a number of other resources as well. There are plenty other amazing organizations and resources out there. In fact, if anything, you might run the risk of being overwhelmed with input and help and suggestions, but that certainly is better than the alternative. Okay, so those are a few things to keep in mind. Let me get to number 5, guys, which is probably one of the most important things, which is things like caregiver guilt, feeling guilty about anything, about how you're taking care of your loved one to not taking care of them enough, or whatever, or caregiver guilt, caregiver bad feelings, caregiver burnout, caregiver whatever. There's a lot of sort of names, but I want to focus on guilt and just the feelings sometimes that come with being a caregiver, wondering if you're doing enough, wondering if you're doing the right thing, feeling guilty, feeling this way, feeling that way, whatever it might be. First of all, I want to, if I can, and I don't know if this translates the way that I mean it, but I certainly hope so. If it helps at all, I'm giving you permission to give yourself a break. Cut yourself some slack. Being a caregiver is honestly one of the hardest things in the world, because not only are you a caregiver for the loved one that you're caring for, but I know you have families of your own. Of course, they might be your family as well. I know that you might have a career or a job or hobbies of your own. You're a separate person on your own. Please cut yourself some slack. Give yourself a pass. Give yourself a break. Be gentle on yourself and know that you are doing the best with what you have. Please, 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 please. You know, sometimes people feel guilty if they use respite resources. Respite can be an awesome resource to literally giving you some respite, okay? When your loved one can be under the care of someone else or a center for a little while. I encourage you to look at these as opportunities to fuel yourself so that you can be as good of a caregiver as possible, and also fueling yourself so that you can be as whole as possible. Remember, you're not going to be able to be a good caregiver if you don't give back to yourself. So maybe I should have talked about this number 5 first, but honestly, please cut yourself some slack. Give yourself a break. Give yourself a pat on the back for all that you're doing, because it's a lot. And you know what? Let the small stuff slide and allow yourself to be helped and assisted if that's what will be helpful. And know that that's important too. Guys, I could go on and on and on. Y'all know I got a big mouth. I hope this was helpful, though, just to give you a couple of little pieces of information that might help. Guys, I'm Dr. Jen Caudle, practicing family physician, on-air health expert, and video creator. Let me know in the comments your thoughts, your suggestions to others, etc., because you will help others. Guys, if you've not subscribed to my channel and clicked the little bell for updates, I invite you to do so. Guys, I'm Dr. Jen. I'll see you soon.